Ever feel like your concerns aren't taken seriously at the doctor's office? Experts say it's a widespread issue called medical gaslighting that can lead to a misdiagnosis and delayed care.
9 News reporter Courtney Yoon joins us live here in the studio this morning to address several questions, including why this happens in the first place and what you can do if it happens to you.
Yes, good morning, Drew and Corey. An important thing to remember is that medical gaslighting isn't intentional. It isn't something malicious or manipulative, but it can still leave patients feeling unheard, dismissed, and without the care they need. Karen Spencer is a professor and researcher at the University of Colorado, Denver, and she's been studying medical gaslighting for decades before it even had a name. She explains it as layers of interaction from personal doctor-patient dynamics to the pressures of the broader healthcare system. Medical gaslighting can be driven by time limits and pressure on providers. Doctors might be rushed and undersupported. It often impacts women, people of color, and trans patients the most. The result can be led to delayed diagnoses and unanswered questions and the feeling of being unheard.
I have definitely had women tell me that doctors told them to go home, have a glass of wine, have a bubble bath, get their nails done, and just calm down. And so I think all of this stuff is, leaves people feeling really hurt, and their problems are unaddressed.
Spencer adds that much of the medical research and knowledge has historically been built around men. The assumption that what works well for men will work for everyone else can leave other groups dismissed and misdiagnosed.
So let's talk about what people can do to combat medical gaslighting.
Yeah, so Karen talks about being an advocate for yourself, making sure that you do all your homework beforehand. If you take notes about your symptoms, bring those to the doctor's office. Even before the appointment, fill out that questionnaire that they give you online. These office visits are really short, sometimes 18 minutes. If you bring it up late in the office meeting when you see your doctor, then that gives them less time to go through your concerns with you. And also bring a buddy.
Yeah.
Yeah.
We've talked a lot about this just in the commercial breaks here. And it's interesting, since you started looking into this, you realize that everyone kind of has a story.
Everyone has a story about it. My mom has a story about it. My best friend has a story about it. My mom was misdiagnosed with asthma for years and years and years, for 40 years. It turns out she has congestive heart failure. It's just something, I guess heart problems, Karen told me, are often missed in women. And this was one of those instances where she was saying, my inhaler's not working. And they're like, okay, well, you need to work out or something like that.
Something else that could be helpful, but it takes years, is to build that rapport with your primary care doctor. I mean, I've been seeing the same guy for the last 16 or 17 years, and I feel at this point I can ask him anything. Nothing's off the table.
Yeah.
He's not going to look at me like I'm crazy if I ask anything. And I just found out he's retiring in May. I'm like, no, you can't leave, doc. Because that trust means a lot in that doctor's office visit.
Right, and if the doctor doesn't work out, Karen says, find another one.
Yeah, it's great advice. Courtney, thank you.